I want to talk about patient health literacy and how we're gonna improve our employees' education to help patient education. And where we should start with that is really focusing on our employees first. Not only analyzing the health problem, but also, is the patient deaf? Is the patient have a language barrier? Do they not quite understand the whole problem with their medical? So how do we help those people? We need to help our employees how to decipher some of these things, so that way they can go in, analyze the patient. Okay, this is the medical part of it, but how are are they demented? Are they deaf? Just hearing loss? Language barriers? Do they speak the same language as we do? So I think if we can break some of that down, then we'll be able to really help our patients. With employees. So, for instance, classes. I think we should have classes a few times a year to really not only just have our employees thinking about the medical side, how do we save this patient's life, but also how do we make our patients feel comfortable with the care they're getting? Are they understanding it? Are they comfortable enough with saying, hey, I don't necessarily want that medication. It made me really ill last time. Can we try something else? So with employees, I think if we can teach them classes, show them how to decipher those things, really try to break down the class standards, maybe do a big slideshow, have drinks and snacks, and maybe do some activities like that to really get the employees engaged, I think would be really helpful. Because the more we can focus on those class standards, the more overall we can make employees and patients more comfortable together. Hopefully have them mesh a lot better, because we can't control patient literacy in a sense. Some people have never gone to school before. Some people have very high education. Some people are just kind of sitting in the middle. So if we can find a common ground and find a baseline, I think that would be extremely helpful, starting with employees. If we can get them to really be involved in the class standards and how we can each patient decipher, what is that patient's needs? Do they understand what I'm talking about? Things like that. Patient education resource, I think, is a big one. So in patient waiting rooms, we can have a TV screen that's going and have just different. So for imaging, for example, the body is an anatomy, just standard anatomy, like, a finger, it's a phalange. This is your forearm, your radius and ulna, your humerus, and just kind of go over something like that. I mean, they're sitting in the waiting room, and sometimes sitting on your phone is boring, or elder people don't have a cell phone, so they can sit there and watch that and slowly get educated. Same with, different procedures. Why would you need a CAT scan of your head? Like, why? Well, maybe you fell down and the doctor's thinking you might have a bleed. And sitting there and listening to these things and watching these things on a TV while waiting for your exam can really help with later things. And that's also little baby steps to patient education. And most people don't even think they're getting educated when they're sitting there listening to that. But maybe later on in life they fell down and they're like, oh my gosh, I have a headache. Well, I was in that waiting room one time and I seen on the screen that I could possibly have a bleed. I should call my doctor. So with that, I think would really help. And with, let's say, imaging procedures, if you're getting a CAT scan abdomen pelvis width and the patient doesn't know why, because you're an outpatient, you don't get to ask a lot of questions. So we send out a flyer that says why this would be the case. Here's how you do your prep. This is some of the things that your doctor is looking for. I think would be very helpful. And acknowledging some of this stuff and trying to help people understand, even if it's just baby steps at a time, at least we're getting somewhere. So with that, I hope you guys can keep in mind about how we should go about serving health literacy and for our employees. Thanks.